So let's see what are the major organs of speech. Why is it important, you may ask? While learning language, definitely we learn how to produce the sounds in that appropriately, the sounds in that language, and we definitely need to know the place of articulation and the manner of the articulation of the sound. So this means that we need to know the physiology of pronunciation. This knowledge will help us pronounce the sounds of the English language appropriately. So being aware of one's own pronunciation is called proprioception. Regardless of the language we speak, we all have the same organs of speech or articulators while producing sounds. Yet the production of sounds might vary from one language to another. A child brought up, for example, in an English-speaking context will develop phonemes of English. A Romanian-speaking child will develop a different set of phonemes which are characteristic of the Romanian language. The way we use our voice also differs. The English-speaking child will learn to use appropriate stress and intonation patterns. While learning speaking in English, we also learn to use our speech organs in new ways in order to be intelligible in English. This process may imply that we will learn to produce new sounds that are not present in our mother tongue. It might be the case of losing some sounds from our own language which are not appropriate in English. We most certainly adopt our organs of speech to produce sounds that are appropriate in English. So on this slide we can see the main areas of the head and the neck that are associated with the production of the speech sounds. The larynx here, also known as the voice box, contains the vocal cords, which can be open and close. While producing unvoiced sounds, the cords are open. When the edges of the cords come close together, the air that passes through them makes them vibrate. We have already done this experiment. We placed two fingers on our Adam's apple, and when pronouncing a voiced sound we felt the vibration, like in the case of B, whereas when pronouncing an unvoiced sound like P, we didn't feel any vibration. So all vowel sounds are voiced, whereas the consonant sounds can be divided in voiced and unvoiced sounds. So we speak using the lips, the upper lip, the lower lip, the tongue, the hard and soft palate, the alveolar ridge. The nasal cavity is also involved in the speech production of certain sounds. The movement of the lower jaw also contributes to the production of speech sounds. So we shall keep in mind that articulation happens when the air stream is interrupted, diverted, restricted or obstructed. And all this happens with the help of our articulators. The articulators can be either active and passive. When speaking about the lower jaw, I mentioned the importance of its movement in the speech production. So that would mean that this is an active articulator. A passive articulator is a position in the vocal tract which contributes to the production of a speech sound, but which does not move. It is also important to know the parts of the tongue. So we shall know where the root of the tongue is, the back of the tongue, the front of the tongue, the blade of the tongue, and definitely the tip of the tongue. Why is this important? Because depending on what part of the tongue is involved in the speech production, a certain sound is going to be articulated. So undeniably, this knowledge will contribute to adapt our articulators to new ways of producing appropriate English sounds and thus become intelligible.